Ladies and gentlemen, this is the Dental Up Podcast, brought to you by Keating Dental Arts, a full-service, award-winning dental laboratory. Each week, you'll learn tips and techniques from real-world dentists, bringing you in-depth interviews, motivating stories, current events, and sports. Here's your host, Sean Keating.
Hey everyone, Sean here. Welcome to another episode of the Dental Up Podcast. Our guest this week graduated from the Herman Ostrow School of Dentistry of USC, and he completed a dental implant residency along with a dental implant specialty in Florianopolis, Brazil. The Academy of Aesthetic Dentistry awarded our guest with the Charles L. Pincus Award for Outstanding Achievements in Aesthetic Dentistry, and the Seattle Study Club also named him one of the top 10 young educators in dentistry today. Currently practicing from Beverly Hills, California, please welcome Dr. Kyle Stanley Dds. How's it going, Dr. Stanley?
Hi, Sean. Thanks for having me on.
Dude, that's so cool you came on, man. And I'm just looking at your picture. You're right there, Hollywood movie star looks, man. That's awesome.
Thanks a lot.
And you're sitting there
I got to fit in around here, you know?
Oh, I tell you, man, I bet you I don't think I've only been to Beverly Hills. I've lived here all my life. I've only been there a couple times just driving through, but what a beautiful place, and just you guys got everything there. I know the headquarters for Rolex is right in your. They do a lot of services right there, and I send my Rollies out there every once in a while, but they go to Beverly Hills, man. That's so awesome.
Right. Yeah, it's it's an interesting place to practice because of.
I bet.
Of course, celebrities and people want to fly in and get work completed in this area. So it's every day is something new and something exciting.
Oh, I bet you, man. I've worked with a few dentists out of Beverly Hills in the past, and they're amazing guys. They're definitely in it. It's such a high pressure with the demanding patients that you have there. You know, the people with the money, they're not the easiest people to work on. I'll take it.
Yeah, it's definitely true. You either have, it's kind of extremes. You either have the very, very easygoing or the super picky, difficult patients.
Yes.
So we've come to know those patients well, and figured out ways of making it a little more practical, and how to talk to them.
No kidding. That is just it's probably a lot of everywhere. You know, you're going to have demanding patients, you're going to have chilled kickback patients. I think it's just the silly human race that we're with, but I think just that 90210 zip code, man, I think it's the most expensive place in all the United States, most expensive zip code.
Yeah, it's an expensive place, it's I wonder if it's the same as kind of San Francisco, Manhattan.
Yeah, I think San Francisco.
Those three places are.
Yeah, I think they're
top real estate.
Yes, I think you guys might be like number 2 or 3, but I know San Francisco with all the techies, man, and the small amount of land and prices of homes, they're through the roof. And
but I think you're right, because everybody has these kind of patients.
Yes,
whether you're in the middle of Nebraska, whether you're in Texas or Miami or anywhere, you're going to have really picky patients, and you're going to have really easygoing patients.
Oh, absolutely.
And a lot of my colleagues will say, like, oh, if you're treating celebrities, aren't they really picky? And it's the same thing. They're human. So you have very easygoing celebrities. Yeah. And you have very difficult celebrities too.
Yeah. And I think that's just, it goes across the board with everyone. I mean, and there's some guys that, like in Beverly Hills, we got all that money, they're chill, but then there's some guys that are just mean as heck when they got the money.
Right.
It's just so weird how that works. I mean, I've met so many guys that are so well off, and they're just so humble, and they're like the guy next door, and that's the way in life it really should be, and then you got these other guys that, I don't know, they're just kind of, it is what it is there. But well,
that's right. Those are the patients that are talking about mamelons, and they use words like interproximal papilla, gingival margin. They know the teeth numbers. Those are the scary ones.
They've been watching too many videos on YouTube, and
they
just got a little too much time. Yeah. What about this interproximal space? I'm thinking about my embrasures being open a little bit more, and the mesobuccal cusp number 9. It's like, what?
I know. You're going, are you a dentist?
That's where you punt. You say, you know what? I don't think I can work with you. I just, no. You got to find the right way to say, when to punt, even if it's on third down, I'm punting, man. I'm not doing it.
It takes a while to learn how to say no, and that's a very important thing that I tell a lot of my students that I teach, the younger doctors, is you'll learn the hard way, because you won't learn just by me telling you, but you'll learn how I learned, by taking the cases that you shouldn't have taken, and going through all the stress and going through everything, and then you really learn.
Oh, absolutely. It's learning in the trenches, man. You can only read so much in the books, baby. You got to get in the trenches and get after it. So
that's right.
Well, hey, dude, I always start off a little bit talking about sports. Now, this is the big week. College football just started, and I know you're a USC guy. You following those Trojans at all, or no? Or
No. I'm not a big football person, but what was interesting is I was lecturing in Orlando last week.
Okay.
And in Orlando, you had the two big Florida football teams playing each other.
Oh, okay, yeah.
And it was crazy.
Oh, they get nuts out there.
Oh yeah, on the plane, because I had to stop in Atlanta on the way out. So on the plane, you had everyone talking. Are you going to the game? Are you going to the game? And everyone's wearing their colors.
Yeah.
And it was wild.
That's so neat. The college fans
are fun to be there.
They're just so they're into it. And especially you go down the Bible Belt area and down, back in Texas, and Alabama and Clemson, South Carolina. I mean, it's just it's almost like a religion on, Friday nights is the local high schools, the town will shut down, and same thing on Saturdays. I mean, it's just such a big thing. And for us out here in Southern Cal, I mean, we got Trojans, poor guy, that starting quarterback is out for the season, blew out his knee, and he's a local kid from Mater Dei. And
okay. We used to play Mater Dei.
Yeah. Oh, those guys are so good. Bruce Rawlinson, head coach, I know him quite well, and he's been doing it for 30 some odd years, and he's just a small little guy, but his voice is like, Sean, man, what are you doing? Because we'd always meet at this Northwood Pizza over in Irvine and after the games, and it's just good times. But I'm excited because it's Thursday night. We got the Bears against the Packers. NFL season starts off, and so start of the season, and then we got Sunday, where all the regular games will come on, and our Rams play the Carolina Panthers, man, and opening in Carolina the season, and hopefully on our way to another Super Bowl. But you got to be huge out there in Beverly Hills. It's going to be just so much crazier come football season, not only this year, but next year when, it's at Inglewood, but it's just all the LA fans and stuff. It's just going to be a big buzz.
Oh, for sure.
And then
we're excited to have that stadium out here. For me, it's kind of cool because I remember when the Rams were in LA, and I remember going to see the Rams at Angel Stadium.
Yeah, me too. We did. We used to bring my boys there, and
so kind of a cool circle for me to be back with the Rams in LA.
Oh, absolutely. And then you got the new stadium, which is going to be a destination. But then the big thing with the Lakers is, LeBron, it was okay last season. They were just still kind of horrible, but they got Anthony Davis or whatever, man. They got this stud, and, it's just going to be a really neat season. I mean, they're almost favored to win it after not being in the playoffs for 6, 7, 8 years or whatever. They're rated like the bookies. They're not wrong very much, and that's why they're in the business. Yeah. And so
it'll be nice to have some good basketball again, because I was actually living in downtown LA when the Lakers were really good, and when the Kings won the Stanley Cup, I was living in downtown LA, so that was a cool time. I was about 2 blocks from the Staples Center.
Can you believe that?
It was great. Well, for good and bad, because sometimes you had a little bit of rioting. But most of the time, just fun celebration.
The guys that are learning from back east, the guys that torch the cars, and it's like, come on,
right.
guys, man, be nice. No, it's so nuts, but it's a good time for our sports teams. Even the Dodgers, they're in the World Series every other year lately, and they got a super good team, and they just need to get over the hump this year and win it all. That Cody Bellinger kid, we used to watch him locally here, and he was played in
Was he an Orange County guy?
I don't think he was. I just remember watching him. We moved to a place called Northwood Irvine way back in the day because in 1987 I seen him in the Little League World Series, and I'm like, where is this team? We had bought our first home in Garden Grove because we grew up in Huntington, but lived in Garden Grove. But I remember
that's where my first home was. Well, with my parents. That's where I grew up,
Trask and Harbor, baby, right off the 22 freeway.
Oh, nice. Yeah. We bought a home in Garden Grove before we moved to Yorba Linda.
Yeah, that was us because it was affordable and stuff. And,
that's right.
We grew up in Huntington, but we couldn't afford that Huntington Beach home. But, but it was a start for sure. But it was just, it's just a great thing to see that. But anyway, so we moved there because of all these Northwood Irvine parents, and I thought it'd be a great place to move. So after we sold the home in in Garden Grove, we moved to Irvine. And, when our kids were old enough to be in the All-Stars, I was actually the manager of the All-Star team. And I'm thinking, we're going to go all the way. First round, we lost. And I was like, what the heck? And it's like, you thought you're going to go all the way. But anyways, that Cody Bellinger dude, he was in the Little League World Series, and his team, he might have been Arizona, I'm not sure, but his dad was the manager, an ex Major League Baseball player too. They went all the way, and I don't know if they won it all or they won the American, so they went and played for the championship, but he was a stud then, hitting out home runs, and he was like the only 11-year-old, and most of them were all 12-year-olds. He was the only 11-year-old, and his dad was the manager, but the kid was driving home runs even back then, and here it is 11 years later or whatever. I think it was 2008 or 9 or something. I'm not sure exactly the year, but he's only, I think, like 23, but he's like leading the league in home runs, and he's just really come a long way from being a local kid in Little League Baseball to making it in the majors, and now he's just blown up. I mean, it is really neat to see, someone that come through, and God, I think he's at 40 or 50 home runs already, and that's just, no one's done that since they were juicing up the ball and juicing up their bodies back with Sosa and Giambi and Barry Bonds. I kind of miss that, man. And McGuire, just launching the balls, baby. It's like exciting instead of all the
superhumans, the juice superhumans.
Yeah, we need a little juice. No, just kidding. All right, dude. Well, hey, let's go ahead and dental up, Dr. Stanley. So let's go through. I mean, I'm going to get a little bit more about where you started and stuff and your college and all that, but I kind of got a thing here. You do a lot of speaking. You're a keynote speaker, and some of your different topics on different things when it comes to mental health and stuff like that. But September is, right now, September is Suicide Prevention and Awareness Month, and I didn't know this till my producer brought me these questions, and it's kind of a somber thing, but I mean, we're looking at notes here that not even the dentistry suicide rate, but the U.S. suicide rate since 1999, it's up like 33%, and that's like in 20 years it's gone up, and the latest results from 2017, but it's up 33%. It's tough, and it's just can you elaborate on some of the causes that create depression or poor mental health, or what are you seeing and what are you thinking about when that's occurring more and more lately?
Yeah, well, the weird thing was I was always seeing that dentists were like the top 1 or 2 jobs in the U.S. And I was like, oh, okay, that's pretty cool. Okay. But then, I had kind of a hard time in my life that many doctors get burned out, and I've seen this in lab technicians as well, and hygienists and, surgeons, periodontists. And so I was saying, how do we have the best job when so many of us are stressed out? Because I started talking with people, and everyone was like, yeah, I'm stressed out. So I started looking into this. And then I found some statistics because, me being like a speaker and a researcher, I always go back to research, right? That's always like my baseline. And so I started seeing some things saying, being a dentist increased risk of suicide by 564%.
Dang.
just being a dentist.
Oh, that's crazy.
And so and it's wild when I'm speaking, you know, I could be speaking for, I don't know, 500 people, let's say. And I say, anybody here know a dentist who's committed suicide? And usually about 70% of the people raise their hand.
Oh, I know.
And that wouldn't be the case if the people in the audience were another profession.
Exactly.
If they were construction workers, or if they were teachers, or if they were stay-at-home moms, or, you know, that just doesn't happen.
Yeah.
And so I started looking into why this is the case. And, you know, selfishly, it was kind of to help myself to realize why I was going through a difficult time. And so, like, one of the big ones, and I have 12 different ones that I speak on, 12 different topics. But number one is an environment of fear. You know, we're always working when people are afraid.
Yes.
And not only just a little bit afraid, but like deathly afraid. There's one study in 2002 that says public speaking is the number one fear.
Okay.
So that's good. I beat that one.
Yeah.
Number two is the dentist.
Oh, dang.
And number three is death, actually. So people would rather die than go to the dentist. And, you know, all of us dentists and, you know, lab technicians, you guys have worked with these patients that are deathly afraid. And they're shaking, their blood pressure is high, they're sweating, you know, their hands are clammy.
Yeah. Oh, yeah.
And oftentimes, because they're so afraid, they don't come in until it's very bad.
Oh, I know.
And then when it's very bad, they need the most work, the most invasive work, you know, the longest work, the most expensive work. So it's kind of this bad cycle.
Yeah. It's so tough, and it's such a bad rap, because I had the same thing with our family growing up in like the 70s when we went to the dentist for the first time, you know, and they're 7 and 8 and 9 and 10 years old. And we just had a bad dentist that couldn't get us numb because we had to have fillings done or extractions. And there's nothing worse than a guy not being able to get a basic block on you. You know, it's like, dude, numb that up. And it just... And I always felt that way, and I didn't like the smell of the enamel when they're trying to, you know, do that silver amalgam. But we could get through that. But the whole thing was the pain, and I swear it's just come so far in the 80s and 90s and the 2000s with doctors just getting better at that, because then I went to the dentist, and I felt no pain ever when I went to a dentist that was, you know,
totally different, right?
A totally different experience. Even the way you couldn't even feel the needle when they went and, you know, wiggled your lip, and, you know, they're getting smart of not being able to show you the you know, the shot and wiggle the lip, and you had no pain, and they didn't start working on it until you could be numb. And it was just a beautiful thing. I had an implant put in where it was just like getting a restoration put on or a crown put on.
Yep.
There's no pain, and that's the way it should be. And it's just too bad that it's like it should be a dental, you know, thing out there where a marketing promo. Have you seen your dentist lately and how enjoyable it is? And you're not having any kind of screaming like all the old TV shows with the famous dental scenes with the dentist, and it's not like that. It's very
so interesting that you bring that up, because that's my number 2 topic, is the media portrayal.
Yes.
The media portrayal hasn't changed of the dentist in 50 years.
Exactly.
You still think of the Little Shop of Horrors person, you know, Steve Martin, or remember when the guy killed the lion and he was a dentist, and how they focused so much on the fact, well, of course he killed that beautiful, majestic creature. He's a dentist, and dentists are all crazy. They like to hurt people. And so I think that really plays into how people think about us. You know, the last time that there was any good publicity on dentistry was the late 90s, early 2000s, when it was the Swan and Extreme Makeover.
Exactly, of Dorfman and stuff.
You know, maybe they took it too far with that, maybe a little bit, but that was really showing, hey, we can change lives. We can give people back their confidence. We can make people excited to start dating again, to go out and get a better job, to take care of themselves.
Exactly.
And that media portrayal, I think I would love to see people like the ADA, the CDA, AACD, all these associations pay money to get positive media portrayals. And like you said, show what it's like to go to the dentist now.
Exactly. Show it.
Like at my office, you've got massage and heat in the chair. We'll put a blanket on you. You have Bose headphones. You're watching Netflix on the ceiling, advanced anesthesia. It's not as difficult as it used to be.
Oh, yeah. I mean, even like that wand, what's the wand where there's no needles. And it's like, dang. It's like, it's like a little machine. Okay, I think we're good. I remember when Hornbrook did me on that one time, man. I'm like, what the heck? It's like unbelievable. And that's the way it needs to be. It really, you need to have a thing out there. It's really neat to see the dentist nowadays. You're not going to have any anxiety. Right. You're not going to have any pain. And you could get in and out in an hour with like the CEREC or whatever. Like you don't have to have a second visit. I mean, there's just so many positives and a change of transformation, of your life. And it's not the old days of like that Carol Burnett guy with his thing in the dental chair. Even Doug Heffernan had one on the King of Queens, which was great. Him trying to swallow and it's not like that.
It's
and
negative.
It's too bad that it's like that. And I think dentists get pulled down when every patient coming in has the same thing. Is it going to hurt? My brother Kevin's a dentist.
Totally.
He always tells him, he goes, I'm not going to feel a thing.
Yeah.
Well,
they did a study where they checked the blood pressure of dentists as they were giving injections.
Yeah.
And their blood pressure can go up as high as 20 points.
Oh, absolutely.
While they're giving injections, because we don't want to hurt anybody.
Exactly.
And so there's anxiety that comes with giving injections as well. And so you get these things where I'll meet somebody, I don't know, because I travel a lot on a plane, and they'll say, what do you do? I say, I'm a dentist. I say, I hate dentists. And I go,
why?
Remember when I just told you that I was a dentist?
Yeah, that's gotta hurt me. I mean, you gotta have some feelings. My people they don't hate me. It's just such an old stigma that it's got to be broken.
It is.
It really is. And maybe that's wearing on because it is tough. I'm sure every day seeing these people, and like my brother Kevin's an endodontist. All he does is endo.
Oh, but they're always in pain.
Always in pain. And I just really love the way he says, "Is it going to hurt?" No, I'm not going to feel a thing. But he kind of says he's got that good personality, and in a matter of seconds, he's got him out of pain. And within an hour, he's done, and everything is textbook perfect. And that patient he has such a good following of people just saying how much they love him for taking him out of pain, but how gentle and how painless it is to go see him. And I think there's some dentists out there that push that, and really with their testimonials are having it to where the patients are just saying how gentle and nice and how trusting they feel. And I think with dentists out there that are real and are real with the patients and their employees and genuinely in their heart enjoy what they're doing. And it's just like in any field, people can tell. And some dentists are wired up, and some people are just a little stressed, and they let the people to begin with, they're not people persons. And it's kind of tough to be a great dentist if you're not a people person, because you're going to be getting people in their face all day. And it's like, dude,
that's so true. I remember in dental school, a lot of people were very people person, but the problem I think with dentistry and medicine is that you get people that work really hard and are generally, on the smarter side. Mm-hmm. And oftentimes those people aren't people.
Exactly.
People person.
Yeah. And they don't want to hear this guy jabbing in their ear like Mr. Nice. And they're like kind of, you got to be like a psychologist, almost know how to handle this person, each one. Like you have to be kind of like the coach, like the psychologist, like the cheerleader. I mean, you got to know when to be a certain way. And that's how I think it's
true. My mentor, Christian Coachman, he says that your patients have to like you and they have to trust you.
Yes.
And it has to be both.
Yes.
It can't just be one or the other. And it's so true.
Yeah, it is, man. And it's just a lot of times your staff can kind of intertwine with these patients and make it all work, where the dentist kind of comes in and does the hard work and, the mechanical work.
Having a really empathetic team really is understated, because oftentimes they can already calm them down before you even come in.
Oh, absolutely. No, it is. It's so neat when a staff has been with a doctor a long time, or even if it's a short time, but if they're all clicking together like a cohesive unit and just on the same page and, trying to treat these people well, and it just shows. True. And those are the practices that are growing, and those are the ones that are sleeping well at night. And it's tough. It's tough in any field. I'm sure you have your stresses, but with dentistry, if you allow it to happen, I'm sure you can have it manifest more like miserable people coming in and I'm letting it get me down, and where you can't, you got to let it kind of hit you off like Teflon. You got to feel it, but you got to try to help them somehow to get them positive on this situation. We're going to make the best of this. And, this is going to be something that, true. It's so important, I think. But no, that's huge for sure. And I'm looking here too that get off track a little bit, but you studied with Dr. Pascal Magni. You did a mini residency, a world leader in minimally invasive dentistry. Tell me a little bit about that. How did that go for you?
Yeah, so I was really lucky to be on something called the aesthetic selective when I was in dental school with Dr. Magnier.
Okay.
And so, he's definitely a world leader in biomimetic dentistry, veneers, bonding. Yeah. And so he basically picked 10 or 11 students, something like that, to work directly with him for about 18 months.
Okay.
And we just clicked. And, I've been teaching with Dr. Magnier for the last, I guess, 8 years at USC.
Kidding. Good for you, man.
And so I just got really, really lucky to have him as my first mentor. He got me into my residency in Brazil and introduced me to my next mentor, Sasha Jovanovic. So he's just been, I call him my dental father.
No kidding.
He is just a great person and an amazing dentist, researcher. He taught me so much, and he's one of the best speakers as well.
Yeah, he's like a dental ceramist too, I think, or something. I just know he's
his brother's a ceramist.
Yeah,
but he understands all the aspects of ceramics as well. It's pretty amazing.
I kind of butcher his name, Magne, but it's Magnier. Isn't he like French or something?
Magnier, yeah. It's French. So he's from Switzerland.
Oh, okay.
Yeah, so he has a French accent.
Oh, man. Yeah, I think I've met him a few times and shook his hand and stuff, but I just know he's the man at USC, man. That's so cool. And
he is.
That's so neat. So tell me a little bit about why did you get into dentistry, and at what point did you think I want to be a dentist?
Yeah, so my dad's a dentist. My brother's a dentist. I never
awesome.
thought that I would be a dentist. Actually, I was always an artist my whole life. I was a professional dancer. I was a professional musician at one point in my life.
What instrument did you play?
I played the bass.
Yeah, like the big stand-up bass, or a bass
no,
like.
I played the bass guitar.
Yeah.
Yeah, so I was in a rock band, and
You like Geezer Butler? You like Geezer Butler at all, the way he plays? Or
yeah, good stuff.
Dang, I love that. We need a bass.
I grew up on the the 80s rock.
Yeah, Hair Nation, man. That's me too.
Right, exactly. So that was my jam. And then in college, I knew I wanted to do something medical, and I originally thought plastic surgery. I thought that'd be very artistic, and then I said, well, I don't know, let me just try dentistry. So I told my dad, hey, I want to maybe go shadow some dentists. And he said, well, I've got a friend named Chris Larson, who's an oral surgeon in Los Alamitos, and maybe you can go hang out with him.
Perfect.
And I ended up working with him for like 2 years and became an oral surgery assistant.
Really?
And I just really fell in love with that aspect of dentistry. And then I applied to dental school, and I got in on my second try, not on my first try. And, just kind of took off from there.
What a trip. Did you work on any broken jaws when you were working with that oral surgeon at all?
I did, yeah.
That's so crazy.
I'd be designing orthodontic surgery stents and, of course, a lot of wisdom teeth and sinus lifts and bone grafts and lateralizing nerves and
crazy.
I've some crazy stuff.
Oh, I know. My brother Kevin, he interned for an oral surgeon too a little bit when he was doing Dr. Stark. He was down in Long Beach, right by the water, and Lawrence Stark. I remember him to this day. And he was an ex-Vietnam guy, that dentist, that he'd work on so many messed up people with all sorts of things. So many jaws relining them and making sure you try to get that bite right. And you just look at the before x-rays and the after. And it's so amazing. And, those are hours and hours under for the surgeries, and the people being under 4, 5, 6 hours. And that's a big thing. And those are the things that we need good, positive media about too. Exactly.
Look at what a team of dentists can do, whether it's surgery or endo or perio or GPs or aesthetics.
Yeah.
I mean, you can really change someone's life. And especially with orthodontic surgery, not only their profile, but their bite and their airway. I mean, these are
totally
really important medical things that we do. And I didn't realize the importance of it and all the different opportunities that you can do in dentistry until I met Dr. Monnier. Because I didn't realize that you could be, for example, a speaker, or that you could be, an entrepreneur outside of having a practice, which are both, two things that I've done since I graduated.
No kidding.
I thought every dentist works in a dental office all day.
No, not really.
I know. And when I started speaking, it was just kind of fun at first. I didn't realize you could have a career, and then it just snowballed. And, sometimes for the last few years, I've done about 40 dates a year. It's become another job for me. And now I have a recent startup as well where I'm using AI in dentistry and it kind of goes back to the stress that we talked about, to kind of mitigate a lot of the stress in dentistry.
That's awesome. No, we need it. I mean, because when a dentist seeks a treatment, I mean, is it pharmaceutical stuff they're getting, or what is it? What helps a dentist the best, do you think, on, obviously medication maybe, but then that could be kind of a tough thing if it's depending on what they're taking and stuff like that. But what kind of solutions do you have some of the guys that are bluesy and just down and out? And what are some of your comments on how to better improve a person's situation?
Well, I think we need public awareness and acceptance of mental health issues.
Exactly.
First of all, I think there's still a big stigma with going to someone and saying, I'm depressed, or I have anxiety, or, I'm having panic attacks. You're still perceived as being weak.
Yes.
And that's not the case when you show how many people are having this. It's almost the norm in dentistry. I hate to say that, but it's almost the norm in our profession. I think we need positive media associations. We need litigation reform. So many dentists are actively fearful of being sued. I think we need debt reform, because a lot of doctors are coming out of school with $500,000 in debt. I'm one of them.
No, stress and anxiety comes with that when you think about that over and over. And again, a lot of other fields are like that, but yet, I mean, there should be a Love Your Dentist Day, and it should be pumped up about dentists. And I've been doing this 35 years now, and it's always kind of been that way. And I feel bad because I work with so many offices through the years, and there's some happy offices, a lot of them happy and just they get it. Yeah. Some are stressful, but it's just something, just me talking to you about it and seeing that, some of the stuff you do talk about suicide, it just really brings up that even my mindset, the dentist, it's like pain. But then after you go to a dentist that's good, I don't mind going to the dentist ever. I mean, I actually like going for my cleanings, even getting in, scraping by your gums and the sound. I think it feels good on my gums. I like it. It's like, get in there. But I was never that way before, and it was.
I was the same way because my dad was always my dentist, so I was never scared of him.
Yeah, see?
And I remember being in high school and hearing a friend say, "Oh, I've got to go to the dentist today. I'm so scared." And I was like, wait, why are you afraid of the dentist? I didn't even get it. I didn't even understand it.
Yeah, exactly. Because it's perceived, like you said, in the media and all the little TV shows.
Yeah.
Oh, you got to go to the dentist.
I always had positive associations. And that's not to say that I didn't have fillings and, things when I was little. I had probably more cavities than many people, but I just wasn't afraid of it.
Yeah.
And I think if we can start out early with our children, and I'm trying to do that now with my son, having positive experiences, going and, playing with the air and shooting the water and, knowing that people are getting their teeth cleaned and they're getting their teeth worked on and just being exposed to it. I think that really helps.
I think so too. And I think with the younger generation, I'm working with a lot of the newer dental students, 25, 30, 35, and I think they can change it. I mean, if we start really working on it now, it might not be for another 10, 15 years, but we can change the opinion of the public, the public of how they perceive a dentist to be, because it shouldn't be that way, because anyone that's practicing nowadays, there are probably still some guys out there that probably can't numb you up as good as some others. But I just think, it should definitely be brought to the forefront on to change the how people feel about dentists. It should be a great feeling, and not. But then again, they worry about the money and stuff.
The average has definitely gotten higher, because just technology has increased.
Exactly. Especially
technology can really help both the patient and the doctor. So like, for example, what we're doing with my startup Pearl, we do AI, but one thing that we do is analyze dental radiographs.
Okay.
And so we can from the doctor's side, we can remove a lot of the liability, because you're not going to miss anything.
Exactly.
The AI will look at the radiographs, and you're not going to miss that caries on the distal of 19 or the bone loss.
It's hidden behind it, and you can't really see that big thing that's going to bite you in the ass there, man. It's like, I get that. No, I totally get that. And I see how dentists are just so scared to do anything above and beyond, because they're worried about getting sued. And I just think, it's practicing smarter and not harder, and just, I think it
totally. And utilizing technology, because technology can help to help with some of that stress. And on the patient side, we have, the product that we have is called Second Opinion. It's basically a built-in second opinion for patients, because I know that patients are stressed out about going to the dentist and getting ripped off.
Yes, exactly.
So when you incorporate AI, you can have basically a second opinion with that one doctor. And it's a third party that will say, based on thousands of doctors around the world, we would agree with this diagnosis.
That's perfect. But then again, you're going to weed out all the knuckleheads that are doing things they shouldn't be doing, probably. So you're going to have
exactly right. Yeah, I mean that's our goal, is to really just bring the truth back to dentistry, both for the patients and the doctors. Actually, we're doing stuff for the lab side as well. So
all I
may help you too.
All I know is I'm working on teeth, baby. They don't feel any pain or nothing. No, it's
right.
I hear you. And sometimes you think, I got this study models and I'm doing temps on. His teeth look pretty damn good, baby. And I'm cutting them all down, and we're capping them all. And
so what we're doing with the lab side actually is we're automating margin marking.
Oh, okay.
And then we're also doing something called scan clarity score, so let's say you get 100 scans coming in from your doctors in a day. Mm-hmm. You could rank those scans based on how good the preps are and how easily visible the margins are. So let's say you have, Sally in your lab that is the best margin marker. You can give her all the difficult cases.
Yes.
And the ones that are easy, you can have them automatically marked by the AI.
Yeah, that's pretty
amazing.
amazing.
Then what you need to do is you can start ranking your doctors. And, let's say you have a doctor who always sends you crap, right? You could say, hey, for the last 3 months, your scores have all been low for us. And maybe it takes you more time, so you may have to raise your fees on that doctor. Or you may.
No, I hear you, but dentists are real. Any lab, when you get a dentist with a conventional impression, they start not looking the greatest. The quickest thing to lose a dentist is to tell them that, you're kind of sucking, but you don't really do it that way. You try to work with them and help them, but it's tough.
So true. Yeah. And you can do it that way by saying, we've we've had a hard time with some of your margins. We'd love to bring in let's say they're using 3Shape right Terra or whatever. We'd love to bring in, a trainer or one of our team and just show you how we're getting better results. And, it'll help you so your margins look better over time. And
yeah, it's our guys that are digital. They're our best guys with impressions. They get it. And
that's good to hear.
It really is, because they have the machine won't let you go to the next level. No, this is not clear. It's like, it's kind of telling you before you can even send it out. And then when you send it out, we got to approve this and that, and we'll see things a certain way. And it makes them practice smarter with all that magnification. And a lot of guys with conventional impressions, man, they're snapping that impression. Sometimes it's the girls snapping the impression.
Yeah.
Sometimes they're not doing any chord. They should be doing double chord. Sometimes they're going in with that Exposil crap and trying to, blanch it away. And it's just nuts. Right. But, I sent some doctors to some other doctors, some big hitters that weren't getting it, and they came in for a day or two and worked on their impression taking. They kind of let their ego go, and I paid my guys to go take the day off and go help them, and it helps so much. And
that's great to hear.
It's important, because some of these guys got everything, but it comes to the whole thing is fit, man. You got fit, function, and aesthetics. If I can't get fit, I can't work on the function, then I can't get aesthetics. And it's just so important. But now with the digital scans, we're getting this stuff. It's so freaking accurate. And the doctors are excited because they're seeing it. Heck, I just got this impression the other day, I got a modelless, my son's out in North Carolina living, and he's worked with me for years, and his wife wanted to move back home. So I said, well, you can be our ambassador for Keating and go look at, there's like 2,000 dentists within 60 miles, like Virginia, North Carolina, and South, whatever. There's 3 states and lots of doctors. And so he went out on the first day. Dennis said, oh, sure, I'll send you a digital scan. And I got it about an hour later, and I'm looking at this thing. And we went ahead and printed a model, because we print our own models here and stuff. We have the carbon printers, and we just love them. And
oh, nice.
Oh, dude, we printed this out, and you could just see the margin. It was a little bit subgingival, but kind of super gingival, where it's just right at the crest of the tissue, like perfect, like chamfer margin and 360 degrees. It was like the most beautiful prep. And this dude is just out of nowhere, just like that. And now we're starting to do work with this guy, but I get it every day with these guys. I've actually transferred some of my guys that do impressions. I've helped them out buying these scanners. It took them 2-3 months to get it down, but it was a lot of work, and getting the people working with them, like you said.
Because what we see is when most people start using scanners, about 80% of the scans are poor.
Yes.
Because, they've been doing traditional impressions for decades.
Yes.
And, the scanner doesn't flow into the margin like traditional impressions do.
Exactly.
Which is why you have to have, something that tells you how good your scan is.
Exactly.
And you have to be able to look at it and see it. Because I know, another thing that one of my mentors says is, if you're a bad analog dentist, you're going to be a bad digital dentist too. Just having technology doesn't make you better.
No, absolutely.
Once you can learn how to utilize technology and understand it, though, you can really take your practice to the next level.
Now, you really can. And even too, like with the patients, like we're going about trust with doctors. If you can get a patient into your practice and show them what digitally, like scan their mouth, their head's tilted to the side, you have this big old 20-inch screen or whatever you got, you're rotating their mandible, maxillary around.
They think it's so cool.
They're so impressed, and they just so, like the old days with intraoral scanner, you got your TV up there, look at your amalgam on the cracks, and it kind of let them see that, yes, we have to replace it. But with the digital part of it, it's just with them now, they really see it. It's like AI. It's like the 22nd century. It's kind of crazy. It's just unbelievable. And what it does, it makes your practice better, and it does take time, like you said. Some 80% of them, and like I said, it takes a month too. Some guys a little bit longer, and it takes some of the companies to bring in their top shots to help them because they're just not getting a few of the tips, tricks, right away. And that's kind of like.
And then I think the problem there is that they send it to you, and you've got you don't see a margin. And they said, I just bought this $40,000 scanner, and I'm getting these crowns back that aren't good because you can't see a margin. So you guys are just having to kind of estimate.
Yeah.
And then they get it back, and they're complaining. So yeah,
we get it pretty quick. With them. I mean, with our people, with what we know, we can help them. And plus the manufacturers, it's not as big as a learning curve as, because some guys, 20 years of taking impressions, they still don't get it. But 2 or 3 months, if you're going to put your mind to it, knowing that you paid all this money, it's not like you paid $150,000 like on a CEREC or whatever. I mean, those guys, a lot of those let it take, collect dust real quick. And it's just, well, this is the scanner part just for the mouth and just for impression taking. And you can really, they got them now. This new Trios they got out, 3Shape, the wireless and all that. I mean, you can literally teach the janitor at your high school how to do it in about a minute and a half and how to scan it. Yeah. But how you prep it is a whole other. You still got to prep the damn thing.
No, it's a whole other thing.
All those sharp angles and all that shit. You can't keep doing that, dude. You got to round off your angles. You got to get the proper enough reduction and on and on. It's still, you got to be a good dentist. But
I think the problem that when people transition over to the digital workflow is they're still doing these like weird feather edges that are very difficult to pick up in the digital workflow. And I mean, difficult to pick up in any workflow, to be honest, when you have these really thin feather edges. So learning how to prep super important.
It is. I got a lot of old time guys in 60s, 70s still practicing dentistry, and I still get a ton of these knife edge margins, slice prep, knife edge, and it's freaking it's like, it's tough, but it's tough with a PFM. You got 3/10 of metal, 2/10 of opaque, and then I got to bring a Denton body porcelain down there, and I'm trying to get all this down to a knife edge finish, and it's just kind of like,
the lab technicians in the world, and this is something that Dr. Manier first instilled into me, is the lab technicians are so important. You can do the best prep, and if you don't have a good lab technician, the patient doesn't think you're good.
Oh, exactly. No, I hear you. And then you got the guys that are kind of good. They got good preps, but then they're sending it off to China or whatever, trying to save $50, and it's like, the doctor, it's just behind the lips it fits sort of thing. It shouldn't be that way. It's just, I don't know. I think it's a great thing what's going forward with technology and everything else. And I think, that time flew by, dude. My guys look at me going, man, we're almost at an hour. But, we'll have to have you on some of the different speaking engagements that you do, different subjects. I know we touched base on the suicide and stuff, and it's just, my hat goes off to all these dentists that are down and out, and I hope they can get help. And it's tough. I mean, it is tough. I know that, but you can't. I just wish I could give better advice. It's just, I don't see the patients all day. I work on models all day, but to see these patients all day, it's got to be tough. It's just, it's just, my heart goes out for them. And if you do have problems with it, I mean, we got notes, and we'll go in the show notes, some of the different suicide prevention lines and numbers and stuff. Just, there might be one person out there just listen to us, and this might, make a call and change his life. If anybody wants
to reach out to me, feel free to reach out to me on Instagram. It's just Dr. Kyle Stanley. I'm happy to talk to you about some of the stuff that I went through and that I've been lucky enough to talk to a lot of practitioners about. And, I appreciate you guys even allowing this topic to be on your podcast, because that's the first thing that needs to happen, is focusing not every single time on clinical stuff.
Exactly. No.
Every season we go to is how to become better at a prep or better at a margin or better at a material. And, you're not going to be able to prep well if your mental health isn't there.
Exactly. Now, we really I think it'd be good, and seeing that I'm the sponsor of this show, we could do whatever we want, but lately we have done a little bit for, how to consolidate your debt and help some of these guys that have all this stress because of all this debt. And then also with lawyers we've had on to help with, just dotting your I's and crossing your T's properly and just practicing better and smarter. But I think this is a big thing. It's always been one of the biggest things out there. Number one suicide job is dentistry, and it's just too bad that it has to be that way. And but whatever we could do going forward, I'd like to help out in any way and, make it a Love Your Dentist Day or Love Your Dentist Month and show love to your dentist. I mean, it's hard to be on their end a lot. And what happened way back in the 60s and 70s and 80s or whatever with your family dentist, it's not happening anymore. There's a lot of new dentists and they're practicing better and the technology is better, and it doesn't hurt to go to a dentist. You should never feel any pain, very little if any. And it's just like getting a vaccination shot, and you don't even feel nowadays, with the different dentists out there. But no, my hat's off for you for helping in this area. And,
thanks so much.
I appreciate you, man. God bless you and your family. And I can't thank you enough for coming on this podcast, buddy, but we'll definitely have you, for sure. In the
yeah, let's do it again.
Yeah. Dr. Stanley, you're the man. And I can't thank you enough for coming on the Dental Up podcast.
Thanks so much, Sean. Really appreciate it. It's been a pleasure.
All right, buddy. Thanks again.
Thanks for joining us on the Dental Up Podcast Show this week. Make sure to follow us on Facebook, Instagram, and Twitter, or search the Dental Up Podcast on iTunes for our weekly feed. Don't forget to visit KeatingDentalArts.com/promo for exclusive offers. Keating Dental Arts is a full-service dental laboratory, and we're nationwide. We'd love for you to send us a case so we can show you the Keating difference. If you dig what you heard, please leave a review on iTunes, and we'll be back next week.